Well, we've told you that JPMorgan CEO James Dimon announced that he's been diagnosed with throat cancer, but that his prognosis is excellent. He's one of about 50,000 people in the U.S. who will be diagnosed with head and neck cancer this year. Throat cancer is a subset of that category. The most common site is considered the base of the tongue or tonsil. Time for a cancer dialogue now with Dr. Jonathan Aviv, clinical director of the Voice and Swallowing Center in New York. He's with us live this morning. Dr. Aviv, how serious is throat cancer, say, compared to other cancers?
First of all, good morning. And also, I want to wish Mr. Dimon a speedy recovery. In answer to your question about throat cancer and how serious it is, one of the great things about most head and neck cancers is that if caught early, one can cure them completely.
All right, and how so? What kind of treatment are we looking at here?
Well, one of the things that happens with throat cancer is when the tumors are very small, invariably patients have symptoms. The symptoms could be something as innocuous as a little bit of hoarseness or a chronic cough or a little pain in the ear or frequent throat clearing or a lump-like sensation in the throat. So very, very early on, one gets symptoms, as opposed to other areas of the body where there's a huge mass that has to occur before people report feeling discomfort and then seeking medical attention. Something as tiny as the size of a hair on the vocal cord can elicit symptoms, and therefore people will then seek medical attention.
All right. So how might you get throat cancer? Any way to pin it down? Is it smoking related necessarily?
Yes, smoking is the single most common reason for head and neck cancer. In addition, alcohol is a risk factor, and there are two other risk factors that are looming large on the horizon as people are smoking less and drinking less. One of them is infection with HPV, which is also called human papillomavirus, and acid reflux is also a risk factor.
Really? We're speaking with Dr. Jonathan Aviv, clinical director of the Voice and Swallowing Center in New York. We're talking about JPMorgan CEO Jamie Dimon announcing that he's been diagnosed with throat cancer. So take us back a little bit to what makes his prognosis excellent, as he said. Why would he feel this way?
I don't know the exact details of the type of tumor he had, but generally tumors that have an HPV origin, a human papillomavirus origin, because it's a viral origin which stirs up the immune system in a better way than tumors coming from smoking and drinking, generally those types of tumors respond much, much better to even lower doses of chemotherapy and radiation than traditional doses of chemotherapy and radiation required for those tumors coming from smoking and drinking to excess.
All right, and explain, too, the stat I read at the top of the introduction. About 50,000 people in the U.S. will be diagnosed with head and neck cancer this year. Is that a number that's growing or stable, going down?
Thankfully, that number has been stable. Almost all cancers in the last 25 years have been stable or decreasing incidence except for esophageal cancer. And in Mr. Dimon's case, one of the cancers we think, again, that he has is either in the throat, base of tongue, vocal cord area. Those types of tumors generally respond very, very well to non-surgical means of treatment.
When a big-name guy like Mr. Dimon comes out and announces that he has throat cancer, does that lead to an increase in calls to your office, say, or other doctors?
Invariably, when someone well-known has a disease that is caused by potentially very, very common exposures. And when we talk about smoking, it's not just smoking cigarettes. People don't realize that smoking cigars is equally as dangerous. There are a lot of cigar smokers out there who seem to feel that that's not an issue. So in this particular case, with Mr. Dimon, we're going to pay attention more to the consequences of smoking cigarettes and smoking cigars, the consequences of drinking alcohol to excess. So those types of things raise awareness both locally and nationally and probably worldwide.
Very good. Hey, thanks for a few minutes, Dr. Jonathan Aviv, Clinical Director of the Voice and Swallowing Center in New York.